Good morning, everyone. Make yourself comfortable as we listen to a few words from someone who has survived addiction and sends a message of hope. His name is Macklemore. Before we begin this presentation, I would like to give a trigger warning to anyone who may wish to excuse themselves as we will be discussing addiction and drug use.
They said it wasn't a gateway drug. My homie was taking subs and he ain't wake up the whole while. These billionaires, they caked up, paying up Congress, so we take their drugs. Murderers who will never face the judge. And we dancing to a song about a bass gone numb, but I seen homies turn gray, noses draining blood. I could have been gone, our 30s faded in that tub. That's Prince, Michael and Whitney, that's Amy Ledger and Pimp C, that's Yams, that's DJ AM. Goddamn, they're making the killing. Now it's getting attention cause Sarah, Katie, and Billy, but this shit's been going on from Seattle out to South Philly. It just moved about the city and it spread out to the burbs. Now it's everybody's problem, got a nation on the verge. Take activists off the market, jack the price up on the syrup, but Purdue Farmers about to move that work.
Welcome to our presentation on the negative impact of the current approach to drug policy in Canada and the need for positive drug policy reform. My name is Shayna, and I'll be your guide today. My partner, Shane, hi Shane, and I ask that you set aside any notions or bias you may have for the next few minutes and keep an open mind to what we have to present.
And these devils, they keep on talking to me. They screaming, open the bottle. I wanna be at peace. My hand is gripping that throttle. I'm running out of speed. Try to close my eyes, but I just keep on sweating through these sheets. For a horseman, they won't let me forget. I wanna forge a prescription, cause doctor, I need some more of it. When morphine and heroin is more of your budget. I said I never use a needle, but sure, fuck it. I'm caught up, I'm on one, I'm nauseous, no options, exhausted. This is not what I started. Walking carcass, I lost everything I wanted. My blind's drawn, too gone to leave this apart.
We hope to present to you today a problem that affects all Canadians to a great extent, one that has existed for a long time. Despite efforts by the government over the past 50 years to reduce drug use and harm to society by enforcing the war on drugs, things have progressively gotten worse. We will be looking at alternatives to this approach in an effort to find a more effective solution.
Re-up, death certificate, sign the prenup. Ain't no coming back from this Percocet activist, Ambien, Adderall, Xanax binge. Best friends with the thing that's killing me. Enemies with my best friend. There's no healing me. Refilling these. They say it's debt. Institutions and DOC. So God grant me the serenity to accept the things I cannot change. Courage to change the things I can. And the wisdom to know the difference. Wisdom to know the difference.
Thank you for listening. Now let's get started. The current approach to drug policy in Canada, often referred to as the war on drugs, has been criticized for being ineffective and causing harm. As we continue on our musical journey today, we are going to take a closer look at the causes and effects the existing drug policy has had on Canadians. To bring us there, the Canadian artist Lights will share her feelings that are not uncommon to many in our society.
Here, in a familiar place, we got our heads down. And then we pretend it's 'cause the night is dark and running out of space for us to run around. But it's a dead end and my knees tight, and it's been a long time of this. Something has got to give.
The over-incarceration of marginalized communities and drug users, the perpetuation of negative stereotypes and discrimination, and hindered access to adequate health and social services for people with substance use issues are just some of the consequences of the current approach. First, by criminalizing drug use, people who are struggling and need support are labeled criminals and institutionalized in inhumane conditions as punishment for their suffering. Often, the substances used are a way of self-medicating. Had the same substance been prescribed, they would have been looked down upon if they had not taken the prescription. To add to their struggles, police enforcement happens disproportionately in marginalized communities.
Let's get on another flight. Maybe set out to sea. Kick it up and shake our fist at it. 'Cause death is harder to come by than it is to breathe. When you gotta make a break for it, 'cause it's been a long time of this. Something has got to give.
Second, there is no regulation of substances or safe distribution system for people to acquire their drugs from. Without proper regulation, the content of the substance, the strength and dosage, and its origin are all unknown variables that have led to the high overdose rates across Canada. Distribution is left to criminal organizations to fill the need, which can cause unsafe situations for those purchasing the drugs, violence and death between criminal organizations, and an increased burden on law enforcement. Third, a lack of education and active miseducation that is currently provided in a propaganda-ish way has led to the stigmatization of drug use and has prohibited those suffering from seeking help.
Nothing gives easy, easy gives nothing. I'm just trying to keep income coming, and dawn is bound to break when the night is done. Always darker days before brighter ones. Brighter
Lastly, inadequate support is offered due to a lack of funding and the belief that there are normal people in society, then others must be segregated and institutionalized. No government revenue is made, drug sales fund cartels, and government funding punishes drug users through the judicial court system, enforcing the laws through police budgets, and spending extraordinary amounts, keeping people incarcerated for non-violent drug crimes.
Everyone here is ready to go.
To address these negative consequences, we need to adopt a more evidence-based and health-focused approach to drug policy. This has been done in several countries with great effectiveness, despite initial opposition based on old paradigms and fear-based thinking.
How much of my mother has my mother left in me? How much of my love will be insane to some degree? And what about this feeling that I'm never good enough? Will it wash out in the water, or is it always in the blood? How much of my father am I destined to become? Will I dim the lights inside me just to satisfy someone? Will I let this woman kill me or do away with jealous love? Will it wash out in the water, or is it always in the blood? just like my brothers. Do my brothers wanna be? Does a broken home become another broken family? Or will we be there for each other like nobody ever could? Will it wash out in the water, or is it always in the blood?
Some possible solutions include a shift towards a more health-oriented approach, decriminalizing all drugs, education and awareness programs to combat stigma and discrimination, and alternative approaches such as harm reduction. Decriminalization would free up funding which could be used for support services, allowing those who suffer from addiction to access what they need to restore their quality of life and address their underlying traumas without the stigmatization or worry of being incarcerated. Regulation of drug production and distribution would generate income for the government, which could also fund the necessary programs to implement this approach, and it would allow the safe purchase of products that are not contaminated and can be dosed accurately with proper warnings, instructions, and resource information if it becomes a problem.
I can feel the love I want, I can feel the love I need, but it's never gonna come the way I am. Could I change it if I wanted? Can I rise above the flood? Will it wash out in the water, or is it always in the blood?
Education campaigns can dispel myths about addiction and drug use to provide members of society with accurate information. This will help reduce stigma, but also let the person suffering know that they are not alone and that there is hope. Education can also accurately inform the public about various substances using facts rather than propaganda. For example, the DARE program teaches that all drugs are bad. When a teenager tries marijuana and realizes it's not only not bad but helps them, they lose trust in what they have been taught, which could lead them to try harder drugs that may prove to be more harmful. Implementing accessible social supports is fundamental to creating a positive change in drug use habits and allow addicts to gambling, eating, shopping, etc. to get the support they need, creating a healthier society on many levels and stronger community and family support systems.
You know I'm back, like I never left. Another sprint, another step, another day, another breath. Been chasing dreams, but I never slept. I got a new attitude and a lease on life is a peace of mind. Seeking a find, I can sleep when I die. Want a piece of the pie, got the keys to the ride and shit. I'm straight. I'm on my way, get up my way. I'm running late. What can I say? I heard you died twice. Once when they bury you in the grave, and the second time is the last time that somebody mentions your name. So when I leave here on this earth, did I take more than I gave? Did I look out for the people, or did I do it all for fame? Legend is Exodus, searching for euphoria, judging through the mud to find the present, no ignoring.
Based on the analysis, the best solution for this project is a combination of all three solutions. However, education about drugs is the first step to allowing other solutions to be implemented. A shift towards a more health-oriented approach to drug policy and decriminalizing all drugs has proven effective in countries such as Portugal and Spain. We can achieve the same here in Canada.
I'm feeling glorious. The crib looking victorious. You know that we've been going it since we hopped out that DeLorean. Yeah, we went on guard. Things are just things. They don't make you who you are. Can't pack up a U-Haul and take it with you when you're gone. We posted on the porch, my family's glasses to the stars. My grandma smiling down on me like, "Whoop, that boy got bars." Okay, yes I do. I said amen and hallelujah. Let me testify to another morning.
Spain has a long-standing tradition of harm reduction and health-based approaches to drug policy. As a result, Spain has a lower prevalence of drug use than the European average and a lower rate of drug-related deaths. European Monitoring Center for Drugs and Drug Addiction, 2021. Portugal implemented a radical shift in their drug policy in 2001, decriminalizing drug use and focusing on health-based approaches. Since then, Portugal has seen a significant decrease in drug-related harms, including drug-related deaths and HIV infections. European Monitoring Center for Drugs and Drug Addiction, 2021. This approach addresses the root causes of the problem and supports access to adequate health and social services for people with substance use issues while reducing harm and over-incarceration. And that's it for our presentation today. Thank you for joining us. We hope you found this information informative and insightful. For more information on this topic and to support our cause, please visit www.drugpolicyreform.org.
She buries the skeletons like she's collecting them. Better lock up your skeletons, throw away everything. It's real life, so don't wait. The time's now, so don't fake. We all just stuck here in one place, just trying to figure out what it's gonna take.
Remember, a positive drug policy reform is necessary to address the negative consequences of the current approach and promote a more health-focused and evidence-based approach to drug policy.
Sometimes when she goes to sleep, she feels like not waking up. She feels like she's in so deep that she'll never make it out. All the mistakes that she made, she just thinks about. Probably the reason that she ain't been sleeping now. Drowning with liquor and spend every weekend out. Only way she knows to quiet those demons now. So don't let them talk to you. Soon them voices will sound very far from you. Trust me, girl, because soon they won't bother you. I'm familiar with them demons inside of you. Back, forth. Her thoughts have been running off course. Feeling so empty inside, cause she's convinced there ain't no choice. Just say it, fuck everybody. Feeling like you could never trust anybody. You've been living in the past though, fucking up your body. Turning down with the Xannies, turning up with the Mollies. Any problems, you just pop another pill though.
She just pop another pill though. Never telling anybody how she really feel though.